Parkinson's disease is a degenerative condition affecting how the brain controls everything from walking to talking, but it also takes a heavy toll on a patient's teeth. So here to explain more about the dental issues with those with Parkinson's disease face, we're happy to welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you.
Thank you so much.
I was just saying during the break, you know, a lot of us, unless you've experienced it firsthand or within your family, you don't think about medical conditions and dental and oral health and how they work. But what are some of the issues with Parkinson's?
Parkinson's is an interesting thing because it has a slow onset where tremor and rigidity start, but as symptoms progress, what happens is patients are on more and more medications to control those symptoms, and what happens is that they get a lot of dry mouth, and saliva basically acts as it washes away the bacteria in your mouth that cause cavities. And if you have dry mouth, basically what happens is that the cavities start really, really severe, basically. And it just gets worse and worse and worse.
So for somebody with Parkinson's, you know, the dry mouth, which there are other conditions that may cause that, what is a solution?
Well, a solution basically is if the teeth are really crumbling, getting worse from Parkinson's from the dry mouth, also from not being able to take care of them because of the rigidity, tremors, stuff like that.
So you're saying because they can't actually brush their teeth oftentimes, and their caretakers can't either.
It's extremely hard to actually take care of the teeth because of that. I've actually had some patients in where they're in advanced Parkinson's and we actually have to try to fix their teeth, and it's almost impossible because they can't sit back in the chair.
Oh, right.
They really can't. And so for a lot of these patients, their teeth are getting worse and worse and worse. They know their symptoms are getting worse with Parkinson's. And what we've done for a lot of our patients is we'll actually take out the teeth before the symptoms get worse, do an implant reconstruction, and give them a new set of teeth that is going to look good as the symptoms get worse, which they will.
And they won't be affected by, the new teeth won't be affected by the medications?
No, 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 no. Implants and the new teeth that we can put in there are not affected by dry mouth and stuff like that. They need very, very little maintenance. And so it's so much easier to take care of.
How do the medications affect the teeth of people with Parkinson's?
Well, mostly it's from the dry mouth that the medications cause.
Yeah.
And so just cavities run rampant, and they can't clean their teeth, and it just gets worse and worse and worse.
And I understand Parkinson's is on the rise.
Yes. You know, we're seeing a lot more research going into it with the Michael J. Fox Foundation. You know, obviously Michael J. Fox has been stricken with it, Muhammad Ali. So it's coming more into the mainstream, but no one has really talked about what happens with the teeth. And basically with the type of practice I do, we do a lot of sedation dentistry. So that means a lot of people need a lot of complex work. So we find a lot of people coming to our office for these kind of unusual things that most dentists just don't see.
Yeah.
And so more and more people are coming in with Parkinson's.
So what I'm hearing you say is for sleep dentistry,
Yeah.
and we'll have you explain that, for people with Parkinson's, it may be the solution if they're having a difficult time now.
Oh my gosh, yes.
How does it work?
Well, basically, we can get you sedated either through a twilight sleep or even a general anesthesia with my anesthesiologist. And basically, that will remove all the tremor and rigidity so that we could get the work done, basically.
Yeah. And more work in fewer visits, I'm assuming.
Yeah. Usually one or two.
And,
Oh, is that right?
and in the end, too, you're avoiding the pain that all of this would cause if you didn't do anything.
It's so much easier to fix this before it gets really, really bad.
Right.
And that's the big thing. We sit down with our patients and we know where this is going. We just want to be able to fix it before it gets worse. We want to make it less stressful for the patient, less stressful for their spouse, you know, their wife or husband, and honestly less stressful for the dentist too.
Yeah, and what I'm hearing you say too is don't ignore your oral health, your dental health, if you're going through some major medical issue, because that's
Absolutely.
very, very important.
Yeah.
All good tips. We want folks to know if you'd like to find out more about Sleep Dentistry Defined, give them a call, 503-646-2273. Dr. Lampee, good to see you.
Thanks so much.
Thanks for coming in.
Appreciate it.